avoiding bright direct lighting, favoring indirect color variable lighting, avoiding fluorescence, which I have yet to meet a person who has defended the integrity of the fluorescent light, using the dental headlamp if you can instead of the overhead, or if you need that kind of additional light, making it focused at the location that you need it to be instead of kind of generally everywhere. Projecting an Aurora style light either onto the ceiling or wall or kind of wherever you'd like to the patient's focus to be, giving somebody something kind of soothing to kind of lock onto makes it a lot easier for that person to kind of sit still and feel supported by their space. And a simple LED strip behind that counter there. We have this projector that puts, stars and Aurora onto the ceiling. There's a heavy base iPad mount next to the chair there because if you've got a show or something that provides comfort, as long as it's not interfering with the appointment, there's really no reason not to take advantage of that. And then a white noise machine that provides, some basic soothing sounds. From an auditory standpoint, again, dampening the extraneous sounds as much as possible, demonstrating instrument use for that kind of tell, show, do approach to, any process. But, if it's the dental drill, for example, using it in the dentist's hand in the chair to kind of give that patient a sense of what it sounds like, using it briefly in the mouth, and then doing the actual work. Offering noise canceling headphones or head plugs, using a white noise machine. If the patient has music that is going to be soothing to them, allowing them to bring that in, provided it's not disruptive to the flow of the appointment. Anytime we are going to touch the patient, explain why. Explain what this procedure is and why it's necessary. Just describe the sensations before using the instruments. If you're using just like a reflex check and hitting somebody, and then you just explain like, hey, this is what this is going to feel like, and your leg might do this. Just preventing surprises, setting clear expectations. These are the kind of things that are beneficial for everybody in a medical setting, but are very, very important when you're working with people with sensory needs and intellectual disabilities. Having headphones available, basically doing what we can to reduce echo, reduce extraneous surprise noises, right? Being able to provide that level of comfort in sort of a patient-directed way, understanding that the person who comes in has a whole life that they experienced before they got there, and they're bringing that in with them. Having clear expectations goes a very long way. And so asking patients and caregivers how they best communicate, explaining procedures and steps to provide context. One thing that we really like is having a whiteboard somewhere visible where the patient can see it and kind of writing out the high-level steps of the appointment. Because everybody, regardless of communication ability or cognitive ability, more or less understands progress through a list. And so having that kind of anchor point where the patient can just glance over and say to themselves like, okay, we're halfway through, this is going to end, right? It gives people an end point. That has real value.